my channel. If you are new, then don't forget to subscribe. So today's video is something that I've actually wanted to talk about and something that a lot of other people have wanted me to talk about as well, and that is how to deal with placement anxiety. I'm going to make this video part of my motivation series because it kind of links in with like looking after your mental health and making sure you're prepared for all sorts of new experiences that you get that come into studying nursing. This video is also quite fitting because I'm starting my placement in paediatric A&E on the 28th of September, which may be before or after I post this, I don't really know yet. And placement anxiety is a real thing. Obviously it's different whether you suffer from an anxiety disorder or if you just kind of get regular anxiety, but regardless of whether you really suffer severely from anxiety or not, everyone suffers from a little bit of placement anxiety. But obviously there's different scales, and anxiety is a whole big spectrum and I could talk about it for hours and hours, but I'm going to condense this video into something short just to give you guys some advice for when you do eventually go into placement, if you are going on placement soon, if you're in second year or third year, or if you just want to know what to expect if you're in first year or if you haven't even applied yet. Placement anxiety for me means just being worried or anxious or nervous about going into a new setting, meeting a whole new team of people, being in a new environment, having to travel to a new place. It is a big difference, and especially if it's your first ever placement and you're just used to kind of doing uni work and lecture work and all that stuff. It is a big change and you don't know what they're going to make you do, you don't know what to expect, you don't know how they're going to treat you, you know, you really want to, it's like you want to be the best person, you want to be confident, and it is a lot to process, it's a lot to prepare for, and so it is completely natural to feel anxious. I'm just going to give you guys seven or eight quick tips to kind of help you reduce the placement anxiety, because you can't completely get rid of it because everyone naturally gets nervous and anxious before starting something new, but hopefully this will kind of ease your mind a little bit. So I'm just going to get started. My first thing to say is something that's kind of a bit obvious, you would do anyway, but plan your route in advance and look at the map of the hospital or the clinic or the site or wherever you're working on your placement beforehand, and quite a bit beforehand. Like, don't do it the night before your first shift because you're just going to be panicking, you're going to have so many different things running through your mind. Planning your route is important, making sure you know what mode of transport you're going to take, how long it's going to take to get there so you're not late, and looking at the hospital map is particularly important because obviously hospitals are very big places, and a lot of the time, particularly if you're studying children's nursing, I can't speak for other courses of nursing obviously, a lot of the time it is quite hard to navigate your way around a hospital or to find the paediatric side of the hospital because it is a lot smaller than the general side, the adult side, etc. So look that up on Google, and all of this, like checking your route and things like that, is particularly important if you have moved away for university, because obviously if you don't know the area very well of where the hospital is or the trust is that you've been placed in, it's really important to get to know the area so you feel comfortable with travelling there and back at all different times of the day. Second thing is, if you're feeling nervous, obviously everyone gets different placements. If you're friends with people who work in different trusts to you, you're obviously not going to be in the same place. So sometimes it can actually help if you ask around and find people who are on the same ward as you or on the same, even in the same hospital or anything like that, just so you have those people that you can reach out to and you can travel together if you have the same shifts or if you live near each other. In my last placement, I found it quite nice to know in advance who I was working with from my course, so you kind of just feel more confident knowing that there are people you know around. At the beginning, when things are a little bit like new and you don't really know who to talk to, you can just feel more comfortable knowing that people you know are already there. If you are by yourself, because that does happen, or if you just can't find or contact anyone who on your course who happens to be on your placement, then that's totally fine. You might turn up to the place and find other students there from different universities, or there might be someone you just didn't realise was on the placement with you from your course. Sometimes that can help, but it just depends on the person really. Also, make sure that you contact the ward or wherever you're working in advance for your rota. So normally you get told your placement area 4 weeks before you actually start, and then by 2 weeks you should either be contacted or contact the people at the hospital or at the ward who will give you your rota. There's a bit less advanced now because of COVID, so I was told about my placement 2 weeks in advance instead of 4 weeks. In your timetable for the whole year, you know what parts of the year you're going to be in placement, you just don't know where you're going to be. They don't always email you. Obviously, different places are very busy, so make sure you find an email or a phone number. Normally that will be given to you on the placement site, and just give them a call and just ask for your rota, as especially necessary if you have children. If you work alongside the course, it is important because you have, I think it's 5 shifts that you're able to change around. So say if you have to work and you can't attend placement, you need to tell them in advance, obviously, so they can rearrange that for you. The fourth thing is to make sure you research your placement area. This is something I mentioned in my placement update video. This is something that I actually need to do because I've got 2 days until I go in. If you find out whatever ward you're on or whatever area you're in, if you're working in, I don't know, sexual health, mental health, ICU, A&E, I don't know, literally anywhere, make sure you know a little bit of a background of what to expect, what types of illnesses or presentations you're going to see, what types of medications are going to be dealt with, if there are any common surgeries involved, if you're on a surgical ward, simple things like that to kind of help you prepare and help you feel a bit more confident with what you're about to encounter and what you're about to witness and the types of patients you're going to help to treat. Number 5, make sure you pack your bag in advance, so the day before, the night before. Plan your meals and your snacks, make sure you're prepared with all the food and the water that you're going to bring. That is really, really important because you don't want to be kind of rushing around for your day shift or your night shift or whatever you're doing and panicking, trying to find your uniform, find your shoes, find your water bottle. Like, it's just so much more stress-free if you organize yourself before the shift. Also make sure that you arrive relatively early for the first day of your shift, because you never know what's going to happen. There might be train cancellations, bus delays, anything like that, and you want to get there. Say if you're starting at 7:30, you want to get there at, like, I don't know, maybe 7, 7:15, so you can find your way to the ward, find where you need to put your things, find where you can get changed in time for handover, because you don't want to be walking in late on your first day. Like, that's just so embarrassing. I was very nearly late to my first day of placement just because my train got cancelled, and it was just the worst luck ever, but luckily I managed to style it out and I got there on time eventually. But yeah, just don't let that be you, because you have to factor in all those types of things. So make sure you plan to get there quite early, just so you look eager, you look ready, and you can organise yourself and kind of get to know where things are before you start. Number 7, make sure you know what needs to be completed on your placement. Depends on where you are, but in most London unis we have a PAD, which is a practice assessment document. That's where you get all your feedback written, you write your reflections for your shifts, that's where you get your hours signed off, your skills signed off. All of that needs to be completed. Like, you're not just going in to follow nurses around for the day, that you actually have to complete certain things in order to pass the placement side of the course or the placement side of that year. So it is really important that you know your way around that booklet, you know what needs to be completed, because if you don't complete it, you're going to have to go back at some point to the same ward to get your supervisor or your assessor to sign certain parts or do what they need to do so that you can get that placement signed off at the end of it. And if you do need help with that, it is quite complicated, so you can always ask your lecturers or your personal tutor or even the nurses that you're working with, because they are trained to understand how the PAD works. So make sure you do that so you're not missing out any outstanding information when you finish the placement. And the last thing is just have fun. Like, placement is very tiring, it is very draining, especially if you're not used to it. I mean, I haven't been in placement for 6 months, so I know that it's going to hit me because I have never done a night shift before, and I have 3 back-to-back night shifts next week, so that would be a nice way to start my placement life back again. But I'm super excited. I'm going to take you guys along. I know a lot of people want to see me do that. I'm going to try my best to do that for you guys. I'll probably vlog the night shifts, and that'll probably be quite funny because I just know that I'm going to be absolutely shattered. But yeah, placement is a really great experience. You meet so many lovely people, both on the team and the patients and the families. You'll be surprised a lot, you'll learn a lot, you will gain a lot more independence and confidence, and it's just really great. And I hope that for anyone who hasn't been on placement yet, that this makes you feel more at ease and more excited for when you eventually do go on placement. Yeah, that's it from me. So I hope this video was informative. If you have any other placement tips or tips to help reduce placement anxiety, then please leave them in the comments below. And don't forget to subscribe because I'm so close to 1,000 subscribers, so please subscribe, tell your friends, tell your mum, tell your nan, tell your dog. And yeah, I will see you in my next video. Bye.